Have you ever wondered if the medication that's supposed to help you might actually be causing more problems? Today's topic might just change how you think about anxiety medications. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today, we're talking about something called benzodiazepine-induced neurological dysfunction, or BIND for short. BIND is a constellation of symptoms that can emerge during benzodiazepine use, during tapering, or after discontinuation. Benzodiazepines, or Benzos for short, are the anti-anxiety medications like Xanax, Ativan, or Klonopin. Anyone who takes a benzo regularly for more than a month may experience some withdrawal symptoms when they stop the medication. Not always bind symptoms, but some level of withdrawal. Typical withdrawal symptoms are things like increased anxiety, jitteriness, or trouble sleeping, and they usually peak within the first 2 weeks after stopping benzos and then gradually improve. Bind symptoms, on the other hand, can be more persistent and may even worsen over time. The term bind is pretty new. It was only introduced a few years ago, but the idea behind it has been around for much longer. Doctors and researchers have been noticing these effects for decades. It was called different things like protracted withdrawal or post-acute withdrawal syndrome. So what does bind look like? Common bind symptoms include anxiety, insomnia, no surprise there, but cognitive difficulties. Some people will call it brain fog, memory problems, depression, depersonalization, derealization, sensory sensitivities, especially to light and sound, but you can become sensitive to touch as well, muscle pain and weakness, and gastrointestinal issues. And these symptoms can vary widely between individuals. The timing of the symptoms can also vary. Some people may start experiencing these neurological symptoms while still taking benzodiazepines, especially if they've been on them long-term and at high doses. Less people fall into that category. Others may notice symptoms emerging as they begin to taper their dose. In some cases, you may not notice symptoms until after you've completely stopped, and that presentation is also less common. It's more common that if you're going to have bind, it shows up as really bad withdrawal symptoms either during the taper or soon after. I've said bind is more common with long-term use. Long-term is defined differently depending on the study or the guidelines that you read, but some sources will say that daily use for more than a month puts you at risk of withdrawal symptoms when you want to stop. But some people think of long-term as any use past 3 months and definitely up to a year of using it regularly. I happen to fall into that camp of conceptualizing long-term as 3 to 6 months or longer. Living with bind can be really challenging. It can affect your ability to work, your relationships, and your overall quality of life. And because the symptoms can be so varied and persistent, it can be frustrating and even demoralizing for some people. Bind symptoms can last for months, and some people have reported them lasting years. Many people with bind feel like they're not being heard or understood, which only adds to the struggle. So what can be done about bind? Well, the first step is to slowly and carefully taper off the benzodiazepine. The tapering needs to be done under close medical supervision. Don't try and do this on your own. And the slow taper doesn't guarantee that you won't have any bind symptoms, but it may make the symptoms not as severe or resolve sooner. So what's a slow taper? There's no one-size-fits-all approach. The exact schedule needs to be tailored to the individual person. But a general guideline is to reduce the dose by about 5 to 10% every 2 to 4 weeks. And of course, this can vary. Some people might need to even go slower, especially towards the end of the taper. The goal is to give your brain time to readjust to the changes. This slow taper process takes some work and intention to do. And here's what I mean. Let's say you're taking clonazepam 2 milligrams twice a day. That's 4 milligrams a day. If we want to reduce by 10% of 4 milligrams is 0.4 milligrams. The pills don't come in 0.4, so we round up to 0.5. This means your next daily dose is 3.5 milligrams a day. Since you've been taking 2 milligram tablets, now you have to get a 1 milligram tablet and take 3.5 of them a day. You'll have to cut the pills to get the half 0.5 milligram dose. Or you'll have to get 2 different prescriptions of 1 milligram and 0.5 milligrams. 2 prescriptions or 2 copayments. Then when you get down to the lower doses, you may need to either cut the pill into the tiniest of pieces or switch to the liquid form and use a dropper every day. Not all benzos come in liquid form. Valium, Ativan, and Xanax are available as liquids. All of these details may seem like nitpicking, but it's the little things that can get you and add up to feel like a hassle, especially when you're anxious or depressed. As such, many people will end up going with the easier route of just stopping at whatever dose that they were taking or tapering it, but going too fast with it. How long you should taper depends on how long you've been taking the medication. If you've been taking them for a year or more, you may need 6 to 18 months to get all the way off. If you start with a higher dose, it will take even longer than if you're on a lower dose. And it's not inconceivable that it could take years to very slowly taper off the medication. Medical supervision during the tapering process is essential, and a knowledgeable healthcare provider can help adjust the taper as needed. Sometimes people need to pause and just wait a while before they continue to go down. But the healthcare provider can be there to monitor for complications and provide support throughout the process. Another strategy your provider may employ is they may switch you to a long-acting benzo like Valium or Klonopin and then taper the long-acting agent. Longer-acting medications have a smoother taper. While tapering, other things can help you manage the symptoms like mindfulness practices, regular exercise, and a diet that's low in processed food can also support your overall mental well-being during the process. In some cases, other medications might be used to help manage specific symptoms. Pregabalin, brand name Lyrica, and gabapentin, brand name Neurontin, or 2 anticonvulsants that may help with the withdrawal-related anxiety. Now, you may be wondering, if a benzodiazepine causes this many problems, why do doctors still prescribe them? Well, the truth is, when used correctly, these medications can be very effective for short-term relief of severe anxiety or insomnia. The key word here is short-term, which is generally considered a month or up to 3 months. If you're currently taking benzodiazepines, don't panic. Not everyone who takes these medications will develop bind, but it is important to be aware of the risks and to have an open and honest conversation with your healthcare provider about your treatment plan. Looking to the future, researchers are working hard to better understand bind and develop more effective treatments. Some areas of study include looking at ways to reverse the neurological changes caused by the long-term benzodiazepine use and developing new medications that might have similar anxiety-reducing effects without the same risks. There's also a push for more education on bind for both healthcare providers and the general public. And the more we understand about this condition, the better we can prevent it and help those who are affected by it. So what's the takeaway from all of this? First, if you're taking benzodiazepines, especially if you've been on them a while, it's important to be aware of the potential for bind. And remember, don't stop taking your medication suddenly. Always work with your doctor. Second, if you're struggling with symptoms that you think might be related to your benzodiazepine use, don't suffer in silence. Reach out to your healthcare provider and don't be afraid to advocate for yourself if you feel like you're not being heard. And remember that although bind can be a very disruptive condition with a lot of problematic side effects, it's not a life sentence. With proper treatment and support, many people do see improvement over time. It might be a long road, but healing is possible. These medications do have their place in treatment when used appropriately. The key is to use them safely and under close medical supervision with a clear understanding of both the benefits and the risks. For more on benzodiazepines, watch these videos next. Thanks for watching today. See you next time.